All right, we are live. And thank you, ladies, for being here this evening. We are celebrating Nurses Week. So I'll get that out of the way and say Happy Nurses Week. And it is also Mental Health Awareness Month. And before we get started, I do like to do a little bit of housekeeping. And that will be to say that what we talk about tonight is for informational and educational purposes only. It doesn't substitute for individual medical or mental health advice. And anything that we discuss tonight represents our own opinions. It doesn't represent the opinions of any employer that we might have. So I always get that housekeeping out the way. And I thought we would go ahead and get started by doing introductions. We may be expecting a couple other people. If so, we'll add them in. But I thought we could just get started by you giving us a little bit of information about yourself, where you're from, where you did your schooling, and any other intro information you would want us to know. So whoever wants to start first.
Okay, I'll go first. Hello, everyone. Thank you so much for having me. I'm so happy to be here. Nice to meet Jasmine. I'm so glad to meet you. My name is Mary Anderson Parris. I'm married. I have 4 children, and I have 3 grandchildren now. We live in Fayetteville, Georgia. I am a United States Air Force veteran. My nursing career has stemmed from being the director of nursing at a state hospital, the state of Georgia's adult mental health and psychiatric services. I've been a facility administrator for a dialysis company, advanced practice nursing for the VA, and then for other facilities as well. My education originally started at Darton College in Albany, Georgia. I obtained an associate degree there. At Thomas University, I obtained a bachelor's of nursing degree. Albany State University, go Rams. I obtained my my MSN with a minor in FNP. I went on to Georgia Southern University, where I obtained my doctorate of nursing practice.
I am Jasmine McKane. Right now, I'm working as a psychiatric mental health nurse practitioner here in Augusta. I'm originally from everywhere. My mother was in the military for 21 years, so I'm a military brat. She settled back in her hometown of Sandersville, Georgia. So that's where I grew up from age 13 until about a couple of years ago. Then I moved to the Augusta area. I actually got my RN in 2011 from Georgia College and State University. I went back and got my FNP with a master's degree in nursing from Georgia College and State University. And then, and that was in 2014. And then in 2018, I did a postmaster's certificate for psychiatric mental health nurse practitioner. As a regular RN, I worked float, basically. I got experience in mother and baby, ICU, step down, med surge, telemetry, everything. And then when I was doing my FNP, I actually worked in the prison system. I was the family nurse practitioner in infectious disease and saw all the infectious disease inmates in the state of Georgia. And now I've transitioned to the VA and I'm doing psychiatric mental health nurse practitioner full time.
All right. Thank you for that. What made you both choose to work in settings where basically there's primarily mental health patients or mental health care being given? So I know your role may not always have been like specifically focused on mental health, but you are working in areas where there's primarily mental health. So what made you interested in that?
You want me? Okay. I'm on mute, so I'll go ahead and go first. For me, especially being in all the settings that I've been in, I always saw that mental health to me was kind of the root cause of a lot of things that people experience, even medical issues. So for me, I feel like even though I'm primarily focusing on mental health now, there was a lot of mental health that I was doing naturally with patients in the acute setting. And as well as the family nurse practitioner setting that I was in the prison setting, most definitely there was a lot of mental health that had to be addressed in that setting as well. So for me, it was kind of like coming back to my roots, because that's actually what I like. I like for medicine to be based on the mind, body, and spirit, and the mind is always first. So for me, coming back to just dealing with mental health, I still see those medical issues, but dealing with what may be worsening or exacerbating those issues mentally is definitely something that I'm actually appreciating now.
As far as me being interested in mental health, I think I was more or less kind of thrown into it when I initially started at the state hospital. Um, but there are so many people that I've seen that were impacted by mental health, and and seeing things in the media, and then having family members and friends. You see it everywhere you look around. I can see how some of these individuals were kind of thrown to the side as being non-productive in society, and just given not really getting the care that they needed. So I felt like some people felt like mental illness was a disease, but I came into understanding that it's not. It's just the illness, just like diabetes or high blood pressure or whatever. These people still needed to have the care that they needed. So I became it seems like I'm always wanting to go outside of the ordinary and try and help. And I'm always trying to do something different. So I wanted to be that provider to take the time to provide the care for those people that needed care. I wanted to advocate for those people. I came to Atlanta to the domiciliary. These are people that are in need. These are people that they don't want them to come to their office because they might disrupt their therapeutic milieu, or they may not be as clean as the next person is, but these people still have a need. They still, mental illness is something that we all need to be readily able to address, whether it's in family practice, whether it's in primary care, or wherever it is. So I went into mental health just thinking that I could make a difference. And I felt like it was my calling. After being in it for 10 years, I didn't want to do anything else. So, and when I came to the Dom, it was like, okay, I'm doing this and I'm doing the family practice, and I had the long background in mental health. Win-win situation. It worked out really well for me, and I'm loving it. There's nothing else that I'd rather be doing.
And for anyone who might be listening who doesn't know, the domiciliary is a residential treatment program. So the patients who are there, they live there, so they're there living there 24/7. And I think when we worked together, Dr. Parris, what we saw firsthand is how often our patients who would come in have had complaints for years, and because they did have a mental health condition or a substance abuse problem, they were just kind of dismissed or they're non-compliant. I know I can think of a time, multiple people said, for example, who had diabetes, that you were the first person who ever examined their feet. And I remember you basically helping a person get diagnosed with cancer who had the same complaint for many years. And I think that really just goes to show how even in healthcare, patients with mental health are stigmatized and dismissed. So I always appreciated that when we were working together, you wouldn't dismiss it. If the person said my stomach's been hurting, which I think that was the case with that individual, he had pain or something for a long time, and just nothing ever would happen with it. So I do appreciate that about you, that you gave them the Cadillac treatment,
yes.
When they came to see
that's
you.
one of them. Everyone that came in the door, they got the Cadillac treatment. It doesn't matter if you're homeless, if you were using cocaine or meth, or it did not. That does not concern me. My job is to take care of you, and your mental illness is not going to prevent me from doing that.
Before we go on, I had another question, but since I thought you kind of brought up a good point about the stigma in Black and brown communities, I wonder if you could just, I know part of the reason I was drawn to being a psychiatrist is because I did have a personal family, a member who had a severe mental illness. And I think, so I'm thinking mid 90s, how it was even explained was, I didn't know what was happening. So I was seeing certain symptoms, and what people were telling me was wrong. Oh, she's sick, or, or people just say, oh, she's crazy. But I'm like, no, I'm seeing a person talk to themselves, and I feel like that probably has a name to it. I don't think that's crazy. I feel like that is a condition. And so Well, I feel like one of my main goals is to like work to destigmatize mental health symptoms, getting treatment, taking medications in Black and Brown communities. And I wonder if you can just speak as people who work, like Dr. Parris working in mental health, and you also, Jasmine, being in the prison and seeing mental health. Just your experience of stigma and like within the healthcare system, and like what you had to do to kind of navigate that.
Okay, I remember a particular incident where I'd say, for instance, say if I was at a grocery store and a patient is someone is in there and they're talking loud and and they're just like, that something is going on, that there's a mental health issue going on. And I remember going into the workplace and at the state of Georgia and seeing the same thing. And I remember how a veteran or a patient would get very, very loud, just very loud. And they would be talking to themselves, just really carrying on a conversation. And I remember how my mentor, her name is Elaine Powell. She's from Thomasville. Go, Elaine. I know you're there. So, but I remember her taking me to the side, and she was saying, she was saying, Marianne, she would call me Marianne, and she would say, you have to recognize this as an illness. And when you see the patient getting to the level height that they're getting, then you come in on a softer level, and just identifying that there is an issue that's going on beneath it. Usually there's something going on with the patient. The patient needs something. 9 times out of 10, if you go to the patient, that's why I think I had a connection with them. I would go and I would say, just tell me what's going on. Tell me what's wrong. Let's talk about it. Let's figure out together. I'll help you figure out together what's going on. And developing that rapport with your patient helps the patient feel confident coming to you and talking to you about whatever is going on with them. And sometimes it's very, very difficult for some people to do that. They can't make that distinction when to do that. And instead of them getting calmer, they get louder with the patient, which makes the patient get louder and louder. And then before you know it, the patient is out of control. So I see that.
What about you, Jasmine? Like just kind of like within the system, whether it's so far where you work at now in outpatient or in prison, how did you kind of encounter stigma like within the system?
Well, I think for a lot of Black young men, because I was in the male prison, I also saw the females once a month as well. I actually encountered a lot of people who were a part of the mental illness mind frame, whether it was substance abuse or bipolar disorder, schizophrenia. The people that I treated were, for the most part, HIV positive. So I saw all the vulnerable population and indigent people as well. So with that, what I have learned is that you have to treat them with respect and treat them as human. And I've done that in every setting that I've been in, but especially in the prison setting. A lot of times these guys are so guarded and not open about things because they just feel like you're going to treat them like they're nobody. Treat them like, hey, you did this crime. I'm not talking to you. I'm scared of you. And a lot of times I can get down to their level because a lot of these people were my age group. They were young, their 30s and 20s. So it was easy to see them and some of my cousins, their mannerisms, things like that. So for the most part, like Dr. Mary Parris was saying, you have to get down to their level and you have to be therapeutic with them. I did have some that had some very severe mental illness. So you definitely had to look out for that. And you always had to keep that in the forefront of your mind that sometimes these people may become non-compliant. And I always try to work with their provider at their prison to let me know when that happens. And so we can actually work with the mental health team to get their medication straightened out. But like you were saying, there's a huge stigma in the Black and Brown communities coming from Sandersville, which is basically below the poverty line. I see that a lot too. I see a lot of self-medicating people, turning to alcohol, turning to drugs. I've had 3 classmates commit suicide. So yeah, I definitely see a lot of stigma in the Black communities that they don't go and get that addressed. You know, people are like, oh, you'll get over it. Oh, I made it through, you will too. And I think nowadays it's more drawn in that people are actually looking now to doing therapy. People actually in this age group now brag about, hey, I'm going to therapy, and I'm rooting for them. And I'm glad it's being brought to the forefront. And we do have things such as like the cell phones that you can do telehealth, telepsychiatry with somebody from the comfort of your own home without that stigma of walking into a building that says, you know, psychiatrist on top of it, because that's what they don't want to do. So yeah, most definitely. I saw a lot of that in the prison and outside the prison as well.
Yeah, I think we have a long way to go as far as just having our spaces not be stigmatizing. I think there's a lot that we can do. And I do feel like part of that last kind of frontier, because I do feel that people are more accepting of therapy and talking more openly about going. And I do feel like medications for mental health issues is kind of like that next barrier. Because I definitely know I get questions like, oh, you know, you're going to do mind control, or you're just making people zombies, or things of that nature. So I think we definitely have made progress, but that's really like that next frontier, I think, to to kind of work on. So shifting gears a little bit, as we know, in the last 12 months, the world has been really upended. We've been living with COVID for about a year, over a year now. Really, things shut down mostly in like March of last year. How would you say that COVID has impacted your practice of medicine, nursing? How would you say that COVID has impacted, and how has that kind of changed as the year has gone on?
I think that COVID has impacted, I mean, all across all healthcare lines. You know, it's just impacted the entire, our entire being, especially in healthcare. The demand is at an all-time high. I think with more is expected and less help, and sicker patients, and not just sicker patients, but dying patients, you know, and having to see those dying patients, especially if you're working in that, in a COVID setting, you know, kind of thing. All the uncertainties of the COVID virus, nurses have to manage their stress, you know, dealing with the psychosocial well-being, and you know, this is very important. You know, we need to, because of the high demand, we need to ease these psychological burdens that are on the nurses right now, especially on myself. I feel myself having to step back and take a look at my stress level, and check in with my family and my friends, and like, you know, we just need to do that periodically, because it has been the anxiety and the stress of just working so hard, so many hours, you know. But we as nurses, you know, we are always customized to just working anyway. But when the COVID came along, it was totally different. I mean, the stressors and the challenges became somewhat overwhelming. It did impact our ability and our actions sometimes. But we should always take some time for ourselves, and, you know, check in with our friends, take a spa day. I'm always trying to get me a spa day in with, you know, working, you know, at the domiciliary, getting a night out with the girls, a date night with the hubby, you know, just trying to balance everything, you know, kind of checking in with my colleagues. We're trying to find that normalcy. So we you know, that's kind of hard to do right now, because what is that normalcy? I mean, this is what it is right now. And even though we've been in it for a year, we're going to be in it for quite a long time. I know that it's not going to always be the back to how it was before. We still are going to have to adapt, and we're still going to have changes, the way we perform our duties right now. So, and as the years and the weeks go by, I'm not sure how long we don't know. Nobody knows. That's just it. It's all up in the air right now. And we're, like, I've heard people say, we're just building this airplane as we go. And we're hoping that we get there safely. And that's basically all we can do right now, you know. So
that sounds a little bit scary, though. We hope that on
yeah,
the airplane,
you
but
know,
you know,
Go ahead.
I like that you bring up that point though about because I think people assume as medical professionals, yes, we know there's a possibility of people dying. We know that's a part of life. We probably are exposed to it more than other people, but I don't think people who are outside of medicine understand what it means to have patients die daily. I mean, even people who work in the ER ICU, that is not always happening, and definitely not dozens or 100 people died this week. And I think just the collective trauma of that. Again, nurses, like you said, and nurses are some hardworking people, okay? Because nurses will be working 312s and have a whole other job somewhere else, okay? When we work, I would work with nurses. I'm like, you work a whole other like job during the day. So um well, for whether for good or for bad, I mean, I think that work ethic is there, and I love that you say check in, and that is also a reminder to me to to think about that. Like, I haven't heard from Dr. Parris in a while. Let me check in, see how she's doing, or just it seems like there was a hard day, or I heard something that went bad. Let me just check in. So thank you for that reminder. What about you, Jasmine? How's COVID impacted you?
Well, I actually was very multifaceted up until October. And the reason I say that is because I was working at the prison doing nurse practitioner, but I also used to work on the weekends at my other job. I have a sense of loyalty and a work ethic that I've actually scrapped as part of my personal care regime. But I was working two jobs. So when COVID hit, at that time I was in transition. I had just moved into my house and my son was still with my mother. And I kind of stayed away from it for the first couple of weeks. And then I was like, you know what, let me use my skills to actually go out there and help these patients. So, I mean, people don't understand like how scared we were going into that hospital every day. We went on our unit and we weren't allowed to come back off for the most part. If you worked on a COVID unit, you had to dress up the minute you stepped foot on that unit, put on an N95 gown, put on this mask. You look like you were in, going to NASA. But where it impacted, I think, for the most part, nursing care was we had to limit how often we went in and out the patient's rooms because, of course, we wanted to minimize exposure, and then PPE was running low. So it was days that I went in and I saw the patient and they seemed fine. And then the next day they're in the ICU on the vent. They turn around just that fast. And, I see people on Facebook saying, oh, it's made up. It's nothing's going on. And then I had to watch these people battle this virus, and some of them didn't survive. So that was very heart-wrenching in the height of COVID, watching that happen and not being able. We advocated for the patients as much as we could, but for the most part, for our own well-being, we weren't really allowed to go in there more than we needed to. So that was kind of bad too, because we isolated those patients. I even had a patient come in the other day who said they still were suffering from being isolated. They isolated themselves for 32 days in the hospital, and now they found it hard to get out of that isolation, even returning back home. And then, of course, with the practice in the prison, we all went to telemedicine. I didn't see my patients in person anymore. And that, of course, it didn't really impact the care because, of course, I always go the extra mile for the patient. But I didn't get that, they come in and they talk to me because, of course, on telemedicine, the way we do it was that the provider was present. And, of course, since the provider was present, the correctional officer was present, too. So with that privacy issue, a lot of them wouldn't talk to me freely like they would when they would come to my office, and we would have a correctional officer outside of my office. But of course, they would be in there with me and get that rapport and be able to tell me what's going on. So yeah, that really did impact the care. And I see that we're slowly building up to seeing people 100% live again. But some patients actually enjoy the VVC. Some people, and sometimes I do too, because I love to be on VVC or video and see a patient light up a cigarette. I'm like, okay, so you're still smoking those cigarettes. They're comfortable. They're in their space. They're themselves at that point. So it kind of helps me say, hey, no, we might not want to be lighting this cigarette, especially not in front of me, because I'm gonna write it down. But just piggybacking on what Dr. Mary Parris said, I definitely learned self-care. Like, it got to the point where I was like, you know what? You've been working multiple jobs for years now. When are you going to give yourself a break? Look what happened. People were here today, gone tomorrow. Spend that time with your family. that self-care became very important to me, which is why I only have one job now.
Yeah. Nurses will have multiple different things going on. Why they go to school too? They're like, "Oh, I'm in school too." I'm like, "You in school and you work two jobs?" So, but I think to me the effort and the dedication is, is from my perspective is very much appreciated. So y'all both talked a little bit about things you've done for self care, but you both have families and other responsibilities, and so with your day to day work, how are you balancing everything? Because we definitely work in a system that can have you working outside of your hours if you're not careful. So how do you balance everything you have to do like on your day-to-day work with your family and just the other hobbies and things that you want to do? How y'all balancing it?
Okay, for me, that I have I'm supposed to be there like 7 till 4:30. It's never 4:30. It's always outside of that. However, I have set aside this time. Clinton and I, we set aside this time. This is for us. This is our time. And we have said, he was in school. So every night he has no school after 9 o'clock. From 9 to 10 is my time. That's our time. That's our time. And we can read together. We can do whatever we want to do together. That's our time. Nothing interferes with that time. That's every day. That's every day. Yes, ma'am. That's every night. I'm not saying nothing else. I'm saying not every night that nothing goes on, but we have that quality time for us. Every weekend, I have time set aside for my children. We have a family call. We do a Zoom call every Sunday from 7 till 8. And I can talk with each of the children. All of us get on the grandkids. We get on the Zoom call. So that is time that we can check in with each other. And so it's just set in stone. Everybody has that Zoom number. Everybody knows that it's time to get on the call Sunday evening. That's for family, and the 9 to 10 are is for Clinton and I. So we make sure we do that. We have a date night. We try to have a date night like at least once a week, twice a month or something like that. We'll go out and we'll say we'll go to Applebee's or somewhere, and we'll sit outside because I didn't want to go inside. So we'll sit outside and we'll have a date night. We'll cut the music on and we'll play some oldie goldies. It's fun. That helps me relax. That is my self-care. Dr. Parris needs that. So,
yes, you do. So one of the gems I'm taking from you, though, is that I love the idea with the Zoom call, too, with your family. And that people are dedicated to doing that. That's awesome. But one of the gems I'm hearing from you is that you basically schedule it. You don't just wait for it to happen or assume that it's going to happen. You've communicated ahead of time, whether it's with your husband or your family, like this is the time that I'm going to have for these things. So it sounds like that's one of the take home gems from that is don't just wait for it or assume it's going to happen. Like actually put that as like an agenda item. It's on your calendar.
It's scheduled.
Gotcha.
Everybody knows it's there. Yes.
I could take something from that because I think I try to be like, oh, if it's not spontaneous, it may not be good. But then guess what? If you don't write it down, probably gonna happen. Game.
I'm kind of jealous. I'm sitting here. I'm really jealous of Dr. Mary Parris right now because I wish I had a child that was that attentive, but I have a 13-year-old going on 40, seems like, and all he wants to do is watch Naruto. So we used to do everything when he was younger, and now, I'm like, well, mommy's home every weekend now. Nah, he's sitting upstairs now watching Naruto. You wouldn't even know he was here. So
and I think for people don't know that's an anime, so that he's
yeah. Oh yeah, it's an anime. It's like Dragon Ball Z was when I was younger. So I can't hate on it because I was a Dragon Ball Z fan. But for me, it was really taking control of my health. Last year when Kemp reopened the gyms, your girl was in there. So I have definitely been going to the gym 3 to 4 times a week. That's kind of like my stress reliever. I know it seems like it would cause more stress, but it does burn a lot of stress from me. I try my best. And Dr. Dooley has told me to go home several times. when she sees me still at work. But I try my best to get away and leave work at work and get off at my scheduled time. Now, sometimes if I'm at home doing nothing, I will, go and look up some patients and go and start some notes and everything else. But for the most part, I have a lot of traveling scheduled for this summer. I actually have put in some days to be off towards the end of the year each month. I'm not just going to wait and save up everything and just go out once a year, 1 week, once a year. I've actually learned to take mental health days throughout. If they're giving them to you, use them. That's what they're for. So most definitely have learned to focus on me and doing self-care and being around more for my son as well, and not working those 2 jobs.
Thank you. So I like that gym, and definitely I think being physically active, we know it's a stress reliever. We know it can help improve mood. So I think sometimes it's so hard for us to actually do the thing that we advise people to do. So the fact that you're actually like taking that effort to do it, I think is another gem. Like, don't just advise it, actually do it.
I have one thing, Jasmine, I think that's great. The mental health days, because I need to take that, and I haven't learned to do that yet. And that's one thing that I need to do. Now, when I get home, and Clint and I, we have our time, and we have our children time on the weekend. But as when it comes to work, I don't know. There's just I need to learn to do that. I need to learn to do that, to take that mental health day from work. And I have to realize that work will go on without me. Work will go on without me. It will go on without me. And I keep telling myself that. And I don't want to feel guilty when I take a mental health day, because that's no good. It's not therapeutic for me when I do it that way, because I worry about what's going on. And I want to learn how to take that, accept that mental health day and use it so that it can be some rest and relaxation for me. I like that idea. I have to incorporate it into my life, though.
Yeah, because if that Dr. Parris, I would be like, take your days off. Go off. When we first started working together, Dr. Parris told me, she's like, I will basically always be here. But these days, it was in time in December. She's like, I'm off every time. And she's like, you can just basically tell me up front if I ain't gonna be able to have my days off in December, because it ain't gonna work out. But other times I would say that, like, take your time off. Like, we got it. We ain't gonna do it as good as you, Dr. Parris, but we gonna take care of it till you get back. And so that's really good gems. Like, don't work so hard that when your vacation time comes at the end of the year, you're totally spent and you don't have nothing left. You're like tired on your vacation. You're tired when you come back from your vacation because you are kind of emotionally spent. So those are like some really good self-care and work-life balance gems. And I know particularly in the playback, often I'll get students or people who may just be interested in nurses. You both also have gone past your RN and done additional practice. So let's say for someone who is going into undergrad, and y'all can correct me if I'm wrong, but I think most nursing degrees are BSN. I don't know if that's the only option. Y'all can tell me, but what advice would you give to someone who is like at that level, going into the undergrad setting and thinking they want to go into nursing?
To be prepared, and there are levels. I was going to say the levels. You have the LPN, and then you have ADN, which is the associate's degree nurse. Then you have the BSN, which is the bachelor degree nurse. Of course, you have the MSN. Now, you can get an MSN without actually going for nurse practitioner. You can get it in education, nursing informatics, or just a general MSN. And then, of course, you have the doctorate of nursing practice. You can also get that without going for nurse practitioner as well. I would say that anybody who is going into the healthcare field, just have a passion about it. Go into it for being an advocate for these patients, because that's what they really need right now. And that's what nursing is there for. No matter what level you're at, you are advocating for those who cannot advocate for themselves. So you always have to remember that. Going in, I would say to just make sure that you are going to a program that's supportive. I know of a lot of weed out programs. You start off with 50 students, only graduate 8. Find somewhere that is supportive. I was so glad to go to Georgia College because they were supportive. They wanted everybody to make it through. Of course, there are always going to be those who don't make it through, but for the most part, those people were like, okay, they went to clinicals, this ain't what I want to do, and they left. It wasn't because they were trying to make it so hard that nobody would pass. So definitely research your program and research what you want to do, because let me tell you something, nursing isn't just about the hospital. As even Dr. Mary Parris said, she has worked everywhere. You have so many doors that are open when you go into nursing. So if you don't like the clinical setting, there are other places you can advocate. You can do home health. Now we have telemedicine coming out. So most definitely, when you go into it, just be prepared to be an advocate.
Jasmine, I 100% agree with you. Everything you said is just, it's right, exactly what I was going to say as well. First and foremost, you have to have a desire to want to help people. If you don't have that, I'm sorry, you don't need to go into this field. And some people go into the field and they think that, the money is good, but you have to have a passion for this. You have to want to. At the end of the day, you're going to have to like your patients. You're going to have to like what you do. Be prepared to be. I tell nurses I used to teach over at Thomas University, and I used to teach in the LPN program. And I would tell nurses that, you have to be prepared for lifelong learning, because it's changing. It's changing. You have to keep yourself up to date on the changes, because you don't want to be left back in the 90s, or because things are changing. Technology is changing. And we have a lot of doctors that have been in healthcare, and they can't get with the program with technology. We have older nurses that can't get with the program with technology. So you have to be prepared to open your mind. You have to be able to learn new things every day that you come in. Each day that you come in is a challenge, and you have to be able to take on the responsibility. Be prepared to uphold the profession. When you come in, you're a professional. You have to come in and uphold the profession, whether you're or LPN or RN or with a advanced practice degree, FNP or DNP. You still have to uphold the profession. Learn all that you can learn with the future nursing leading change. You have to do that, and if you can't do that, then you may need to think about something else that might be along another line. That's lifelong learning. You gotta love it, my people. You gotta love it. I promise.
Like how sweet you are about it. You're like, it just might not be, maybe something else. One thing that I had a live with social work, and I kind of made the same observation, but of course, like social work and nursing also are, female dominated professions. And one thing that I admire really about them, as being in medicine, where, depending on what specialty you're in, maybe pediatrics is all female, but, for the most part, the leadership is male dominated. And particularly in medical school education is white male dominated. And but I really appreciate about nursing is that it's majority female, and just the leadership, the ability to grow leaders. So, oftentimes we'll see, like in hospital settings, a lot of times in the leadership positions, whether not even directly in nursing, they're trained as a nurse. I know in Atlanta at one point, our actual medical director of the hospital, that was her background. It was in nursing. So what is it about nursing? Is it the profession? Is it because part of me feels like because it is mostly women centered, then maybe other women will understand, let's say like work-life balance, or with kids, maybe they're more open and receptive. Like, what is it about the nursing profession that really molds and grows leaders? What do y'all think?
Okay, so like I said, I think I'm not sure, Jasmine, how you feel about this, but I think that what really grows the nurse is that you have support. If you have the support that you need in your profession, in your work area, and you see that there's growth and you see the support that you have every day, then that's going to make you want to go on. It's going to make you want to. That support can either break you down or it can lift you up. And in my career, I've been so fortunate to have people in my corner to support me, to push me along the way. I remember when I was an LPN and I was working night shift and I was working ICU, and I loved working ICU. It was the best, and I was really good at it. But there was this RN, there was an older lady, and she said, Mary, you are already doing the RN job. You are already doing it. You need to go back to school. I'm like, I was comfortable, but she kept pushing me. And she kept, she was basically the one that pushed me into going to RN school to get my associate degree and then on to doctorate, and other people being a role model. And Jasmine, you can speak to this. You can attest to this. Being a role model around other young people, they see what you're doing. And I have 4 children. My oldest son is an RN. My oldest son became a facility administrator. Okay. Remember I said I was an RN, then I was a facility administrator. Now I went to get my FNP. And then now he says he wants to get his FNP. My baby daughter went to psychology school. Okay. I told her to go to nursing. No, she took the long way around like mom did. Remember, I took the long way around with the Air Force. Well, now she's obtained her RN degree. Being a role model, having that support system around you, Dr. Dooley, that is going to grow the nursing profession. Being a lifelong learner, and you, us, Jasmine, us in there sharing this information with these young people that we see that we can make a difference. We can. It is up to us to make a difference, and we can teach them. We can show them. We can be that role model for them. And that's how I feel about it.
Thank you for that. That definitely sounds like a different kind of educational experience that I had. So it's nice to know that there's, again, we know people are different, but there is something about nursing that seems like it's more supportive, it sounds like.
Yeah, I definitely will agree and piggyback on that. In fact, I'll use the example that Dr. Mary Parris used about being a mother and how she talked about how she groomed her children. I think, when I became a mother, I was never timid, but there were a lot of things that I'd be like, a little shy on, wouldn't address. And then as soon as I became a mother, I was like, this is my baby right here. I gotta be that person for my child, that advocate. And so I think when you get to taking care of patients, you have no choice but to become a leader because you're speaking for them. So you have to have that voice. So, after you get the experience and you say, hey, this don't sound right. No, I don't think this is the best choice for this patient. You talk to doctors with the knowledge base that you have, and you're basically, you get delegated tasks, but you have that critical thinking up here. That's a part of being in the profession of nursing, to say, okay, I don't think that this is the right treatment plan for this particular patient because I know that patient. So I think it's easy to learn those leadership skills and actually learn how to delegate as well, that nurses tend to move up. You may become a charge nurse. You may become a director of nursing. You might become the chief nursing officer if that's what you want to be. But I feel like that nursing as a whole does groom leadership skills because of the advocacy portion of it, because you have to speak up for those patients. And you are kind of like, you're that stopping point. For the most part, everything comes back to the nurse. That's the first thing we learn, every time they do a risk management assessment, the nurse is the last stopping point before that medication is administered or before that task is carried out most of the time. So we have to hone those critical thinking skills. And then we also have to be leaders in our units, in our hospital or in any care setting. So that's the reason why I think nursing grooms those to become leaders.
Thank you so much for that. And just in talking about that, and I think some of that kind of interaction and systems and with physicians, we're going to save that for our talk that we have like during NP week, because I think that I think as in nurse practitioners clinically, as that grows, I think that there can be some degree of, I'm not going to say issue, because it's not an issue to me, but for some physicians, the role of the NP and what that means clinically. And so we'll say that for our discussion that we all have this specifically around NP stuff, because I think that's a good point to bring out. And you're right. I remember as an intern, just graduated from medical school, right? July 1st came and I show up as a doctor. I realized I don't know how to really do anything. Like, you know what I'm saying? Like, I've been a student and I've done some rotations, but day one, people are coming to me, okay, Dr. Dooley, what do you think? And I distinctly remember some nurses being like, I wrote some orders, and the nurse is like, all right, Dr. Dooley, well, usually we give this, and the dose was wrong. And I was like, okay, thank you. So you're right that I have always appreciated my career, the nurses who took the time to really teach you what to do. Because most of us, unless we were an EMT or we have some other medical experience as physicians, haven't really done a lot of independent things on our own. And so I always appreciated that first intern year, because I couldn't have made it. I think about the patients and how many mistakes would have happened if a nurse wouldn't have just taken me gently and been like, oh, Dr. Dooley, we don't usually give that again in 2 hours. We usually give that at 4 hours. I'm like, okay, Q4, so you are so right about that stopgap with nursing, and really just teaching the next generation of not just nursing students, but even like interns as we come along, kind of helping us, particularly in that first year, because we are like totally green. Most of us are totally green when we get there. Well, we have got around towards the end of our time. So I want to thank you all again for being here. And if you have any last words you would like to share or wisdom to anyone who may watch this later, people interested in nursing or just want to know more about the nursing profession, any last words or comments?
I think we both trying to think of an ending speech. I didn't come up with ending speech, but I definitely encourage. There is still a shortage in nursing, so I definitely encourage anybody who is interested in becoming a nurse to definitely reach for the stars on that. I didn't mention, I don't know any personally, but I didn't mention there is another path you can go, which is CRNA, a nurse anesthetist. That's another thing under nursing as well. So if there's anybody out there who wants to obtain a degree and then go on to advance yourselves, I am actually so very proud of seeing so many people who look like me. I'm going to say that right now, who look like me, that are going into nursing, that are going and getting doctorate degrees, they're going and getting nurse practitioner, CRNA, everything. That like the sky's the limit. And I'm hoping anybody who's going into nursing takes their career full blast and goes for the highest degree they can.
Thank you.
I agree with you, Jasmine. I didn't prepare for ending a conclusion or anything, but I think that I see so many people, so many young people going into the health to nursing and like you say, advancing their career, because this is what we're going to need. We're going to need to have these young people educated. We're going to have them ready to step into the role because we're not going to be in that role. So we're going to have to grow them into that role so that they can be prepared to take the reins when it's time. And we can leave a legacy. We can leave our legacy, Jasmine, and we can show. I mean, we can show them now how it should be, the profession, how to grow the profession, and how to love what you do, and take care of your patients and advocate for your patients, and go to the Capitol and advocate for your patients. And it's a great career. You get a chance to meet some awesome people, and you have the key to maybe helping them take their health to another level. You have the key. So nursing is a great career to go into, and I applaud anyone that is thinking about going into it, because there's so many so many avenues that it can take you. The sky's the limit.
Thank y'all for that. I kind of threw that one on y'all at the end. I didn't have that on the list. So I appreciate that. And I just want to say again, thank you for taking your time for being here. Happy Nurses Week. I'm going to end the broadcast. If you guys could stick around for just a minute or so after I end it, I would appreciate it. And thank anyone who's watching now or who may watch in the playback. If anyone does have any questions for Miss McKane or for Dr. Parris, you can send me a DM, a message, and I'll be sure to get that information to them. And again, ladies, thank y'all and thank everybody for watching.
Thank y'all. And happy Mother's Day. I think I forgot to say that.
Happy
Oh,
Mother's
yes.
Day.
Happy Mother's Day.